The RV254 trial is a study of acute HIV infection in Thailand. What we do is that we screen for acute infection in clients who walk in to the Thai Red Cross Anonymous Clinic for HIV testing. And we look for people who have been infected with HIV for the past 4 weeks or so. We then offer them the opportunity to come into the study, in which we have immediate antiretroviral therapy that they can start, and usually people start that day or the next day. And then we follow them to see how they're doing in terms of their HIV disease, and that also offers us an opportunity to ask them for participation in future HIV remission research. In the RV254 study, we found that when people are treated so early in acute infection, particularly if they're treated when they were still negative to the anti-HIV antibody testing, that they have extremely low HIV reservoir. Their viral burden is really barely detected sometimes in the blood. And we've also looked into tissues, such as in the gut, in the lymph nodes. We also look in the CNS, in the central nervous system compartment, and we see very low virus. We also see that they have a more preserved immunity against HIV. They also have lower immune activation. So overall, we see very good outcomes in people who start treatment early and can stay on HIV medications. I think that people, once they find out they have HIV, it's a devastating event in their life, but they also feel fortunate to be able to know early and to be able to start on treatment. And so we're very fortunate that the Thai participants, they're in general very willing to participate in research for altruistic reasons, and they take very good care of themselves. They take medication regularly. We have very high viral suppression rate in our cohort. We have now, the first participant is reaching year 10, and we have over 90% of viral suppression in the whole cohort of over 500 people now. We're trying to look into what happens very early in HIV infection in this cohort. You know, after 3 decades of HIV treatment and research now, we still don't quite understand when HIV comes into the body, what cells it infects first, what happens first, how the body defense is mounting a response against HIV. So really trying to understand in a molecular level, a cellular level, what's happening. Because I think that this is critical in understanding if we want to give interventions very, very early to change the disease course, what do we need to do? That's one area of research. The other area is once people are on treatment and have viral suppression, we wanted to understand better what is not reversible. So, for instance, we see that brain function is almost normal, like someone without HIV, which is very different to people who are treated late. But then there are some things that don't reverse completely, like not all immune activation is reversible. So we're trying to find out what else we can do to help people be healthier. And the third area of research is to look at HIV remission trials. What else can we do that we can give people an opportunity to come off their HIV medication and still maintain good health, maintain low viral load? So those are the 3 areas of research we're